what areas do you have concerns about?
I'm looking at these lines here
Uh-huh.
and around my lips.
Yeah.
And this mostly bothers me, and the lines here, and maybe at a later time the neck
Okay.
also. But
Okay. So, when you're looking at your lips, what sort of aspects are you wanting to change about your lips?
these lines
Okay.
that I have here and here, and the lips are very small
Okay.
and thin. I'd like to plump them up.
Okay. Have they been thicker in the past?
Yes.
Okay.
Yes.
So with time, they've kind of, the pink part of the lip has gotten smaller,
Yes.
and the white part of the lip has gotten longer?
Yes.
Okay. And now they're getting little vertical lines
Quite
along
a few.
the top? Okay.
Mm-hmm.
And when we look at your cheeks, is it these lines along here that are bothering you, or is it just the fact that the cheek is coming down and you want it to come up more?
I would like this up more, but I'd also like to get rid of these lines too.
We call these lines the marionette lines. We can put threads in here as well as around the mouth, and threads to lift the cheeks.
Okay.
There are 3 different types of threads. There are smooth threads, spiral threads, and cogged or barbed threads.
Okay.
This is the smooth thread, and I'll go ahead and let you hold this so you can get a good look at it. And if you want to hold it up in front of your face there, you can kind of see the little thin fiber. It's as thin as a piece of thread that you would sew with. This type of thread is used in pediatric cardiac surgery to sew wounds. So it's been used in surgery for 20-30 years. This would go in areas where you want to create some volume.
Okay.
We can put it along the cheeks,
Okay.
along the chin, along the lip, and then later on go in there and put it in threads that have cogs or barbs that then actually lift that tissue. So this gives more substance to the skin. A thread that gives more volume is a spiral thread or twisted thread.
Mm-hmm.
And the thread is twisted around the needle. And I don't know if you can see that. It's a very light blue thread.
Mm-hmm.
And so that's put into the tissue, and that would be a place you'd put it in nasal labial fold or the marionette line.
Okay.
And you can also put that around the lip margin. Okay. While it's in there, you're not going to see a result immediately. You might see some immediate swelling, but these threads slowly develop collagen. And in about 3 to 4 weeks, you'll see more improvement as time goes on. Your initial swelling will go down, and then the collagen will start to take over. After we've put in smooth threads and some spiral threads, we can then go in and put in a barbed thread or a textured thread, cogged thread. And this is the instrument that we use to put it in. It's blunt tip, so it's not sharp like the needles.
Okay.
And you can take a look at that if you like.
Mm-hmm.
And this thread is a little bit thicker than the other threads.
It is much thicker.
And it's going to be more supportive.
Mm-hmm.
All the threads dissolve.
Okay.
So,
And the collagen grabs a hold of the thread and helps to plump up.
the collagen forms around the thread, and with more time, more and more collagen wraps around it. And eventually this thread dissolves. Okay, and what's left behind is the collagen. And so that's what eventually keeps the support up. That may go away in about 2 years. But because this thread is a little bit bigger or thicker, it's going to be more substantial in holding up your tissue. Okay. It's a nice alternative to, or even if you've had a facelift and you want to kind of freshen it up, you can put some threads in. Or you've had some filler, but you are worried about too much bruising or that it's going to look too noticeable. These are really nice options to look into and to participate in.
And you're not having the downtime.
You don't have the downtime.
Excellent.